If you have Medicaid and you're getting ready to turn 65, do you even need Medicare? Most people say, I'm happy with Medicaid. It pays for everything. Why would I need Medicare? Well, the government requires you to apply for all benefits that you're eligible for, which is why you were required at 62 to apply for Social Security, even though you might not have wanted that to take that earlier at a reduced amount either. When you're on Medicaid, you have to take all federal benefits that you are eligible for. So how many people are actually on Medicaid and Medicare? Way more than you would expect. It's like over 10 million people. So Medicare is healthcare. Medicaid is aid. So it's financial assistance for people with low income and low assets. California got rid of their asset tests. The whole rest of the country is still looking at your income and your assets. So you could have low income, low assets, and you could be 65 or older. Boom, you're on Medicare and Medicaid. Now, Medicaid has certain doctors that you can see. Medicare, you can typically go to any doctor, but then they would have to accept Medicaid. And that can be somewhat of a problem depending on where you live. Doctors get paid a lot less for Medicare, even less for Medicaid. So there are doctors that don't want more Medicare and especially more Medicaid patients, and it makes it a little bit of a trouble, especially if you are trying to see a psychiatrist. There are very few psychiatrists that accept Medicare and Medicaid, and that becomes a real nightmare for people. So let's talk about you. You have Medicare over here on this hand. You have Medicaid. You're turning 65, and now you're seeing that you might be able to get a private Medicare Advantage plan. You're like, why do I need a third thing? Why do I need something else? I'm already not paying for my health care. I have good health care. Why would I possibly want something additional? That's because a private Medicare Advantage plan that's built for people on Medicare and Medicaid, it goes around it. It gives you coverage, more coverage than what you currently have with Medicare and Medicaid. Now, these types of plans are called dual special need plans. They're not available everywhere. Typically, you're not going to find them in rural areas. But if you live in a medium to large city, you are going to find many different insurance companies that are offering this type of plan. And again, you're like, why do I need it? Because you need it. I'm not saying you definitely need it. I'm saying you need to look at what's available where you live. You need to know what's available. Call our team at the Medicare Family. Let us research what's available in your zip code for this year. Because when you see TV ads and ads on Facebook in your mail that talks about, get this insurance plan that will give you this, and this, those are typically plans that are only available for people that are on Medicare and Medicaid. So if you're just on Medicare, those really rich benefit plans are not available to you. And why are there so rich benefits available to people on Medicare and Medicaid? Because these people typically need more assistance, right? So these plans might give them rent assistance or food assistance or meal assistance. Again, what benefits are available are dependent on your zip code. So that's where we need to talk to you specifically about where you live and what plans are available. But if you are on Medicare and Medicaid, I don't want you to think, we're good. You are good, but you might be able to be even better if you had another insurance plan that gave you even more benefits. One of the most popular benefits of those type of private Medicare Advantage plans is transportation. They're going to give you so many Uber or Lyft vouchers to go to your doctor, to your pharmacy. Some allow you to go to the grocery store. You might say, well, we have a community van and they give us transportation. That's good, but this is personal private transportation. It's very attractive benefit for people that don't want to drive because price of gas or they're sick, or people that don't have a car. So that's a very attractive benefit. So when you get ready to turn 65, call us 3 months before, let us research what plans are available, and then keep in mind if you're already on Medicare and Medicaid, you can get one of these plans at any time of year. And then you can switch if you find out there's one that's better. Hope this helps. If you've learned something today, give me a subscribe.
If you like this video, you might really like this video. Check it out. And we'd appreciate if you subscribe to our channel so you never miss a great video. We put out one every week. Check in the description below this video for a link to our cheat sheet on Social Security and Medicare. And you can also give us a comment If you have a specific question, always feel free to call us or email us at the Medicare Family.